PCOS is a hormonal disorder, and as you know, it mostly affects women. Today, I will tell you how we can manage PCOS. First of all, it is important for you to know that PCOS treatment depends on symptoms, age, and whether pregnancy is planned or not. The treatment of PCOS is usually a combination of lifestyle changes and medicines, so you need to maintain both in order to manage PCOS effectively. Today, I will explain everything in detail that will be helpful for you. Let's get started. First of all, let's talk about lifestyle, which is a very important part. The first and most important thing is a healthy diet. As you know, a balanced diet helps keep your hormones and insulin under control. This means that in your diet, you should include vegetables, especially green vegetables, fruits, whole grains such as brown rice and oats, eggs, fish, nuts, and seeds. These foods are very helpful in PCOS, so you should start adding them to your diet from today. You should avoid junk food, sugar, sweets, soft drinks, white bread, fast food, and excessive fried foods, as these are not good for your body. Avoiding these foods will help you manage PCOS effectively. Along with all this, regular exercise is also very important to treat PCOS. As you know, being physically active also keeps a person safe from many diseases. You should try to exercise for 30 to 40 minutes daily. Walking, jogging, yoga, and cycling are all part of PCOS management and play an important role in its treatment. As you know, PCOS causes the problem of irregular periods, so exercise helps improve menstrual cycles. It reduces insulin resistance, helps with weight loss, and also improves fertility problems. In addition to all these things, proper sleep is very important. Getting 7 to 8 hours of sleep is necessary because staying awake late at night can disturb hormones. Poor sleep also increases the chances of weight gain and insulin resistance. Along with this, stress management is very important because stress causes hormones to become even more imbalanced. That is why you should try yoga, meditation, and deep breathing. Taking some me time for yourself is also essential, so make sure to set aside a little time for yourself. Thirdly, drink enough water. Drinking 8 to 10 glasses of water daily is necessary because water helps remove toxins from the body and improves metabolism and digestion. So, take care of all these things. Now let's talk about the pharmacologic treatment of PCOS. As you know, PCOS has no permanent cure. It only has symptomatic treatment, which helps in managing the symptoms. So, let's get started. The first problem that occurs in PCOS is irregular periods. For this, oral contraceptive pills, also known as birth control pills, are commonly used. They help regulate the menstrual cycle and balance hormones. However, these are used only when pregnancy is not planned. As you know, these medicines also have side effects, so it is usually recommended to try to manage this condition through diet and exercise as much as possible. The second problem is insulin resistance. For this, metformin is mostly prescribed and is widely used. It improves insulin sensitivity, helps control blood sugar levels, and supports weight loss. However, it also has some common side effects, such as nausea and stomach upset. The third problem is excess hair growth and acne. For this, anti-androgen medicines are given, which help reduce facial and body hair and improve acne. Medicines for fertility, if pregnancy is planned. If a woman wants to conceive, ovulation-inducing medicines are used, such as letrozole clomiphene citrate. These medicines help the ovaries release eggs and increase the chances of pregnancy. Apart from this, some supportive medicines are also used, such as vitamin D supplements, iron, and folic acid. If you have any questions in your mind, you can ask them in the comments, and I will upload a video to answer them. I would like to share one important awareness point with you. Most people think that PCOS medicines are lifelong, but this is not true. When lifestyle improves, doctors can reduce or even stop the medicines. Many people start self-medication in PCOS, which is very dangerous. Metformin should not be taken without a doctor's prescription because an incorrect dose can increase hormonal imbalance and make periods even more irregular. Many people also believe that oral contraceptive pills cure PCOS, but this is completely wrong. These pills do not cure PCOS. They only help regulate periods. When the pills are stopped, symptoms usually return if lifestyle changes are not maintained. Another common misconception is that metformin is a diabetes medicine, so taking it will cause diabetes. This is not true at all. Metformin only helps improve insulin resistance. Similarly, fertility medicines should not be used without ultrasound monitoring or a doctor's recommendation. Creating awareness about these points is very important, so please take special care of all these things. One more important thing to keep in mind is that PCOS is different in every woman. As you know, everyone's body system is different, so it is not necessary that a medicine which suits one person will also suit you. Therefore, never start medicines by looking at someone else or without a doctor's recommendation, and do not take medicines based on someone's advice. Another thing that people often misunderstand is that getting regular periods means PCOS is cured. This is not true, because medicines can make periods regular, but hormonal and insulin imbalance may still be present. That is why tests and regular follow ups are very important. Suddenly stopping hormonal medicines can be dangerous, so they should not be stopped immediately. You should always follow the proper plan given by your doctor. For example, if birth control pills are stopped suddenly, there can be a chance of heavy bleeding. Also, PCOS medicines should not be used during pregnancy.